mind questions for me?
Yes, I will read questions for you.
Okay, perfect.
All right.
So the
Let's see.
hardest thing about doing webinars is not seeing the other people.
I know it's so different that you're speaking to a group by yourself and you're just like, okay, I hope everyone enjoys.
Yeah, you've seen me presenting, right? And I like to ask questions, and the awkward silence doesn't bother me, but nobody's
Participation
gonna answer
kind of,
me.
keep everybody lively. And so it's always something, it's always a challenge to take that away from a presentation, I think. But all right, I'll get us started. Welcome back again to night 6 of the webinar series. We're super excited to have everyone. Whoop, there we are. We're super excited to have everyone here with us tonight. Just a few housekeeping rules before we get started. Like every other night, if you have any questions, please be sure to use those chat and Q&A boxes. And we'll get those questions answered at some point during the night. And if you have any questions about attendance and certification, I'd be happy to answer those tonight or over email as well. I can share my email again in the chat box. And so, with all of that being said, I'll let Dr. Saulo Zoca kick off tonight. He's our beef cattle extension reproduction specialist here at the University of Tennessee, and we're super excited to have him on tonight again for this series. So, take it away, Dr. Zoca.
Thanks, Mallory. Uh, Thank you, everybody. I see here we're still getting numbers up here and over 160 people. Very exciting, having this large of crowd to talk with. Uh, I was talking with Mallory before we join with y'all here, and as we go through these slides, just send your questions on. Don't not necessarily need to wait for the end of the presentation, and then Mallory will let me know. And then if it's something specific, she'll just stop me and we can talk through as we go through these slides. Or if something more general, we'll hold some of the questions to the end and we'll address. We'll try to address every question today as we go through here, or either during or at the end of the presentation. If I don't get to answer your question, or you think about something later on and you want to talk with me, I hope you have enough time here. So there is my email, there's my office number. Not really a good method of contact. Really, contact me over email. It's much easier. I'm not hardly ever in that office. So if you really want to talk with me, send an email. I'm pretty active on responding emails. Okay, so getting back to this presentation. So I want to talk something about the bull. So I've been working with bulls for many years now, even though I started with UT a little over a year and a half ago. But I really enjoy the bull side and bull fertility. So I figured that'll be a good topic for me to talk with y'all this year, is understanding that bull fertility. And the way I have this presentation set up, it is I want to get y'all thinking way beyond just what happens in the farm. Okay, so really let me know, put questions on that box if there's something you don't understand there, and I can stop and explain a little bit better. So if we're talking about bull fertility or the bull, right, what is the function of the bull? I think that's the first thing we need to be thinking about, right? And the bull, when we think about the function of that bull should be able to produce a highly fertile sperm in enough quantity that it possesses the ability to being efficient and successfully delivered. So put into the cow, and the ability for that sperm to generate a pregnancy. That's what we're looking for. So in summary, the function of the bull is to get the cows pregnant, right? So for the bull to accomplish that, he needs to have body vigor. He has to be physically sound. Structural conformation is extremely important again. Masculinity, that is kind of related to libido of that bull, and then the general health of that bull. So the only method or the standard method or the only method that we currently have to evaluate bull fertility is through a breeding sounds exam. And when we are doing a breeding sounds exam here, we look at three different components. The first one is the physical soundness there. So we're going to look at eye of those bulls. And the reason, so why eye is important? Well, the first method the bull will detect females in heat is through sight. So he will see females congregating, mounting each other, and that's how he'll detect them and go check and figure out which one of those female is actually in heat by smelling them and figuring out those pheromones, right? And eat the mouth there so they are able to eat and maintain their body condition, right? So if they're starving and losing body condition and not being able to eat, they're not going to be able to breathe. Structural soundness, feet, legs, penis, prepuce, making sure the bull can expose that penis. There is no attachment there. There's no warts on that penis and things on those like that. Then, excuse me, we look at the testes here, making sure that the testis is not attached as well. The test should be able to move inside that scrotum. Should looking for any disease defects there, such as inguinal hernia. So basically, there shouldn't be any intestines in there, things like that I'm talking about. And then finally, on the physical soundness here, we're looking at the accessory sex glands. And the only way we can evaluate the accessory sex glands, so those glands are the ones that actually produce the fluid portion of the ejaculate. So the testes will produce the sperm, and these glands will produce the fluid portion there. And it's through palpation. So we have to rectal palpate these bulls to be able to feel those structures. Then we get into the scrotal circumference. That is an estimation there of the output, the ability of the bull to produce sufficient sperm that we talked about earlier. And then the semen quality, which is the last portion there. So when you think about the semen quality there, we're talking about motility and morphology. When you talk about motility, it is to pass a BSE here, it has to have at least 30% motile sperm. And we can do that through a regular microscope, or we can use fancy machines. So this is a computer-assisted sperm analysis machine that will track individual sperms and give us very accurate, very objective, instead of subjective measurement of sperm motility. There are some other things here. If we're using for AI, we have a little higher standard for that fresh semen, but then when the post-thaw will be similar as the BSE. And in morphology here, so basically we're looking at the shape of that sperm. And we want the sperm looking like this A panel here, that is a normal sperm. And we need 70%, at least 70% of the sperm within that ejaculate to be that normal. If there is too much of defects, things like we're seeing here on these other panels, if it's greater than that 30% defect, then that bull would fail the BSE, right? So when you think about the outcome, basically we have three outcomes. The bull pass, so it is a sex factory potential breeder. The bull fail, then there's two outcomes. That bull fail and it's deferred, so that bull needs to be retested. So whatever problem we detected with that bull may be overcome with time, and we can go and retest. And we're going to talk about some of those things that might be a retest in the next few slides here. Or that bull has a problem that will not get rid of. We cannot fix with time or treatment, and that a bull will be an unsatisfactory potential breeder. Unsatisfactory potential breeder. Okay, so 20% of bulls on an uncycled population is expected to fail their BSE. And that'll be due to that poor semen quality, physical sounds, or a combination of the two. So what we've seen when we think about, so Mallory, I think we have a question there. Somebody raised their hand.
Yes, you're good. As far as the raising hand, if you just have a question, please be sure to type that in the chat or the Q&A box, just because we keep our participants muted just throughout the webinar from our end. And so if you have a question, that Q&A and chat box is free and open to use.
Thanks, Mallory. So continue here, right? So when we look at research wise, this study here with 37, almost 3,700 bulls there, 23 or almost 24% fail. So the unsatisfactory and the deferred bulls are just combining them as fail. Now, this other study here, almost 2,900 bulls, 18%. 1,300 bulls, 37% fail. 200 bulls here in another study, we're looking at yearling bulls, 36% failed there, and 57% of those were physical problem alone. And even within our bull test here, so this is data I've been compiling. It's part of my master's student research, Adela Lonas. We've seen that. So we have over about 350 beef bulls there from the past few years there. And we are running about 24% failing rate. So those bulls that fail, most of them is not that they're infertile. They're actually subfertile bulls. So they would get some cows pregnant, but not a lot of cows pregnant. So here's another data set from my lab that is part of Adele's research. And we've been collecting the pregnancy data for our research education center for the past 2 years. And what we're seeing here, if we look here on the top 4 bulls and the bottom 5 bulls, we have about the same number of inseminations. And there's about a 10 percentage point difference in fertility. And the question is, why? Right? So if we look at here, and especially if we look at these 2 bulls here, right? So D and K, there's about shy of 8%. So if we just estimate here 8% of difference between infertility of those bulls, and let's estimate that calculation for a 100 cow herd. Now here's some assumptions that will make more sense as we go through. Okay, first of all, let's look here. So if we think about 4 cycles, so each cycle is 21 days. So if we do AI on the first service, and then we have 3 cycles with this the same bull or same level of fertility, or if we have the same bull going through 4 cycles, so we talk about 60 to 80-day breeding season. Okay, it's just an estimation here. It's just so I want you guys to get the point here, how much this 8% reduction will cost you. So we see here on the first service will be 62 and 54. And then if we maintain that level of fertility throughout all of them, then we get 23% of the cows, or almost 24% of the cows pregnant, 24.8, 9, 11, 3.4. If we look at the total cows pregnant, it's not a huge difference there. So 2.4% difference, right? So it's not a big difference there. Now we bring more assumptions there. So if I assume my steers that are born from these cows that got pregnant here in the first service are about we're weaning at 600 pounds, my heifer is 500. Now, if I assume they gain 2.2 pounds per day, these animals here on the second were born 21 days later. So they would have what, 46.2 pounds less just because of age. And I'm assuming their genetic is the same. Okay, both A and B is the same genetic, it's just fertility differences there. And then it goes on, right? So another 21 and another 21. And then I calculated based on these pregnancy rates here, how much pounds of calf would be weaned here. So just because of the distribution, the difference distribution here on pregnancy, it's a 1,900 pound difference on weaning weight, which reflects on almost a $5,000 difference in profit or revenue, not profitability. I'm sorry, it's revenue. Assuming here a $250 % weight. Okay. Now, this is thinking about 100 cow herd. What if we think about the 28.2 million cows that we have in the United States? If there is an 8% reduction in fertility, that would cost $1.35 billion lost in revenue. So maybe if you're thinking locally on a small scale, that may not seem much when we look at those numbers that I just presented. But when we think about the whole system and the efficiency of our beef cattle production, it is a great economic impact. So the way for us to combat it will be making sure we do a breeding sounds exam before each breeding season. And I say each breeding season because I know in Tennessee we have several producers that will have a spring and a fall breeding season. So now I'm going to flip the page here. Let's look at the semen quality and fertility. And before we can dive in here, I want to do a step back and start really from the beginning here, right? So there are physiological impacts on that semen quality, and they're associated with the spermatogenesis, so the production of that sperm. And then after that sperm is produced, how it's matured, and then how that sperm interacts with all the fluids it is swimming on. So the testicular fluid, the epididymal fluid, and then when it's mixed with those accessory sex gland fluids, so the seminal plasma. And I'm not going to go through details here, but I have this figure here just to highlight how complex this is. And this is just the cell division and differentiation portion of this process. So we start with round cells right there on the top, all the way to that very differentiated sperm cell right here in the bottom. In reality, that sperm here is not really this sperm. As the sperm is released and go through this portion of the test here that's called the epididymis, there's further maturation and then when it reaches this tail here, that's actually when that sperm becomes, it looks like what we think a sperm looks like, okay? And during that process, that transit, those fluids that it is in, there's several molecules that interact with that sperm, either taking away or putting things on or in that sperm. So it is both on, so it's outside and actually inside, so it does both. So normally, that test needs to be slightly cooler than the body. So if we disrupt anything within that system, we can cause issues on our sperm production and the quality of the sperm being produced. So the test is being slightly cooler than the body is part of maintaining that good environment for the sperm to be produced. So in a study, what they did, they insulated that test, the testes, to see what would happen. Similar to what would be a heat stress, for example. So here is the thermal insult here on day 0. And I have here, so this dashed line on the top would be the threshold for normal morphology for passing a BSE. And the bottom dotted line here will be the minimal threshold for passing a BSE on motility. If we look at the dark line, the black line here, throughout this process, even after the insult, we never drop below that motility threshold. However, if we look at that normal morphology proportion there, we are way above that 70% here, and up to 9 days here, we're still fine. We'll be passing a BSE. But then after that 9 days, there's a huge decrease here, and it takes a long time. And that's because that process that I just showed you, that spermatogenic process, takes about 60 days from the beginning to end. So, and remember when I told you about the epididymis there, the storage, I'll go back here. The storage right here. So likely the reason we are not seeing differences here within this first few days here, it is because that sperm that is already stored there was not affected by this insult. There are things that may happen that it would impact them, and this will be shortened. But then we start seeing sperm that were on that machinery and that process of production there in maturation coming out in the ejaculate. That's when we start seeing these issues. And if you look here, even almost 40 days after that insult, we are still not on the threshold for normal morphology. Now, besides the physiological issues, we also have some other issues that are not the animal fault, but it's us when we're handling that semen. and is associated with our AI. So if we, which our AI industry does a really good job, but some things that could impact negatively impact that semen quality, right? So when we collect it, if we cause some cold shock, so we caught extreme temperatures there. When we are diluting that semen, so with extend the time that takes for us to do that. When we are freezing that, so the cryopreservation there, how fast we go down on that temperature. Then we, after it's all done and frozen, how well we manage that semen on the storage of that liquid nitrogen, the liquid nitrogen level in the tank. When we handle that semen for thawing process, the water temperature, between the time between we thaw it and we use it for AI, all that can impact the quality of the semen we are using for our AI. Now, let's look at the here. So we can cause a sperm injury when that frozen semen reaches negative 110 Fahrenheit. And if that injury occurs, putting the sperm back in the liquid nitrogen, it is not gonna solve or not gonna correct that problem. When it's done, it's done. Now, here is a picture of the neck of that nitrogen tank. Negative 110, we're about 3 inches from the top. That's where roughly we are. And this is about that frosted line we see. Now, when we see things like this, it makes me worry. It likely we are not going to be having really good storage here, and the quality of the semen we are storing on these places is going to be decreased. I don't know if you guys can see here, but there's a screw here in the stopper. Is that stopper doing the job that's supposed to, that is keeping that nitrogen there, keeping hot air to go from outside to go in? Probably not. So we are losing a lot more nitrogen. Maintaining this tank is going to take a whole lot more work, because we'll probably need to refill it more frequently because it's wasting a lot more nitrogen. Bringing the straws all the way to the top here. This was a picture for in a magazine. There's a cover of the magazine. This is not what we're supposed to do. We're exposing, look how many cans of semen we have here, and we're exposing to this temperature. Negative 110 causes issues. Look where we are, and taking pictures. Okay. Another one here. If this scenario here, if you're not careful, sorry, we're gonna go out of nitrogen really quick here. This is an emergency. You need to go and get everything out of here as soon as possible, like yesterday, because you're gonna run out of nitrogen and you're gonna lose everything. If it dries, guess what? You lose everything that's in there. Now, this is what I would like to see. Using tweezers to stay below the frosted line there. Say, working inside there. On the thawing side of things, so here's they are using sex semen. So, and they're thawing everything at a temperature that is recommended, 35 to 37 C. Okay, so 95 to that 98.6 Fahrenheit. That is the normal range. What they did, they got the straw that they thawed appropriately. One part of them, they kept at a good temperature, which is the green line. One part, or one straw here, not one straw, but a group of straws, they actually increased the temperature. They went to 108. And in one group, they drop it to 40 after they thaw it. And this is basically refrigerator temperature. After 15 minutes, look at this difference in progressive motility of sperm. And what we're trying to do is we want to maintain as many live motile sperm as possible within their insemination dose to optimize the amount of females we can get pregnant with that dose. This will likely generate much less pregnancy than this, or the chances of generating pregnancy is lower with that one. So being careful with how we handle that semen. And this can happen, okay, we're breeding in December, you tie appropriately, you put on your gun, and you keep waving your gun here and keeping that the temperature outside in December. It's a good chance that you're breeding cows and it's the outside temperature is this or close to this. What are we doing with the semen quality? So the way we need to be thinking is we need to work that as soon as possible and try to maintain at that uh, optimal temperature as close as possible. So even after insemination, there are several things that can happen that can impact that bull fertility. So if we're thinking about here, there's several females barriers here, right? So if we're thinking about natural cervix, the bull is going to put the semen here and the sperm needs to go through that cervix. That is a big barrier there. Then AI or bull, AI, we're going to put the semen here in the uterine body, and then it needs to swim through the horns, get to the oviduct, and when it gets to the oviduct, guess what? It is a very intricate and intimate relationship between the sperm cells. So this is the sperm head, and these are part of the oviduct that really grabs that sperm there. And as the sperm go through this process of capacitation here, it starts releasing from that bottom of that oviduct. And there's a lot of biochemical process, a lot of molecules involved with that capacitation process that makes the sperm swim all the way through the site of fertilization. And here we have the egg and the sperm. And there's, again, a lot of molecules that are associated there that needs to happen there for that sperm to fertilize that egg and generate a pregnancy. So here's what I like to describe it, that bull fertility is multifactorial. It depends on a multitude of events, and we talked about several of those events. They must occur in an orderly fashion for a viable pregnancy to be established. So there's a lot of things there, and we're still efficient on getting them pregnant, but there's a lot behind the scenes there that sometimes we overlook. So now I want to start talking about that both physiology, going further in depth there. Okay, so when you're thinking about the development of those bulls and them reaching the puberty, we go from an infantile period, from the pre-pubertal period to the pubertal period, where there's no sperm production to there is sperm production there. And that involves the APG, which is the hypothalamus, which is a part of the brain, the pituitary, which is another part that is attached to the brain there, and the gonads. So in the case of the bull, that'll be the testis. And it's very neat what happens there. So if we look at, so we have 3 periods here, as described before. A will be infantile phase, B prepubertal, and C pubertal and post-pubertal phases. Okay. So if we look here in the beginning, we have 3 hormones highlighted here. So we have LH and FSH, which are gonadotropin hormones, and we have testosterone. Okay, so early on at an infantile phase, we do have LH and FSH circulating, but we barely have, or it doesn't have any detectable levels of testosterone. And the structure of the testis is basically all the pieces are there, they're just not developed yet. As that bull start aging and maturing and the brain developing and the hormones, we're going to be discussing a little bit about how these hormones play a role here. As they start maturing, it's starting getting off of that infantile phase to that prepubertal phase, where there is an increase here on LH and FSH, and testosterone start increasing. And then what happened is, if we look here, those are histological cuts of that sperm. We start seeing that those seminiferal tubules starting forming. The spermatogenesis start occurring all the way through. We get here to that 32 and 40 weeks where it's very defined, large. So this is the same scale. Look at the difference in size of those seminiferal tubules, right? And then we start seeing some sperm already inside those seminiferal tubules as the animal mature. With the LH specifically, what we are seeing here is at that early ages there is a high concentration of the LH hormone, and we're going to be talking about these hormones from now on, and hopefully we can get a good grasp here So that LH has high amplitude but low frequency. So this, we have hours here, and here will be the concentration of those hormones. As that bull age and the brain starts maturing, we start having that it's still high amplitude, but it's a very low frequency. So very high frequency, excuse me. So we start having more pulsatile of this. And then we start decreasing the amplitude of those, and then kind of decreasing again the frequency until we stabilize here at about 30 weeks. So what is going on here is after this year, right, when you're thinking about a post-pubertal animal, there is that peak of GnRH hormone that will stimulate the release of the LH and FSH. What happened is when we have that peak of that LH, it will stimulate the testosterone, which inhibits the release of the LH and the other hormones. So when testosterone go down, there's another peak of these hormones, and then testosterone go up again, and it keep going here. And you can see here, it's hourly. It's every couple hours, 3 to 6 hours intervals. So that is the cycle on the male. You remember the female, we were talking about 21 days. The male is much shorter cycles. So basically, we have two main cells in the testes, which are the Sertoli cells, which are the structure. They're basically the house, the building there that keeps everything together. And then we have the Leydig cells that are the cells that will produce testosterone there. So they're responsive for that to that LH stimuli, and they will release testosterone. Early on in life, we have very little cells of that Leydig cell. And as the animal mature up to 7 months, there is a huge increase. There's different cell multiplication. So there's hyperplasia, increase of number of cells. Now, from that 7 month on, there is very little proliferation of those cells. What happens is hypertrophy. Basically, it's a growth of the cell. So that cells become more active. They will produce more testosterone, and they will keep releasing testosterone up and increasing in size up to about 24 months of age. So the other hormone, I start mentioning it, is the GnRH, right? So the GnRH is in the brain, and the GnRH stimulates the release of LH and FSH. So there's two studies here that I want to present to you. The first one, so if GnRH is releasing that hormone, LH and FSH, and those hormones help us on puberty, well, let's give more, and that will be better. That was the idea on this first study here on the top. So they did that between 1.5 and 3.5 months. So they just did a prolonged stimulation here. What happened is actually they decrease the frequency of those pulses that we are trying to increase. They decrease the concentration of FSH and testosterone even after they stopped the treatment. The puberty was delayed. There was decrease on test weight and decreased number of those germ cells. Germ cells are basically the cells that will produce sperm. So I talked about Sertoli, that is the block that keeps everything together. The Leydig, that is producing the hormones. And the germ cells is the actual ones that are producing that the Sertoli cells are holding up in place there. Okay. Now, okay, so if prolonged exposure is not working, what if we try to mimic those little pulses that I showed you before? What if we try to mimic that? So that's what they did. Every 2 hours, they would go and give an injection there of GnRH to try to mimic. And that was for between 1 to 1.5 to 2 months of age. And by doing that, they're actually able to increase the pulse frequency and the mean concentration of the LH. So basically actually helped, which led to increased scrotal circumference, increase the test weight, the seminiferal tubules. So that the histological thing, pictures that I showed you, basically the tubules there become bigger. There was more Sertoli cells, so more cells on that structure. They're holding everything together when they reach that 12 month of age. So what about the LH in puberty, right? I've been talking a little bit about it. But basically, when we're looking at contemporary animals, the secretion of that LH, or the pattern there, is associated with the puberty and the age at puberty. So there is some genetic affecting there on the development of the sexual development of those animals. Okay. So I want to bring this and explain this as kind of a backbone here, or the basis of what we're going to be talking next. Because so I want to talk about bull nutrition here now. And several of the impacts we're seeing is related to what I just explained to you. Not necessarily you're going to have to remember every single details, but I think it gives you a better understanding what we're going to be discussing from now on. So this first study here, they look at the nutrition on sexual development. Basically, they did 3 treatments with Holstein bulls from birth to I think about 7 month old bulls, if I remember correctly. So about basically adequate. So the middle one there, it's a maintenance, or the adequate development there, so they're gaining appropriately what is recommended. Then they did a low gain, so gaining 60 to 70% of what was the requirement, and did a high gain, gain 160%. So what they saw, when they decrease nutrition, those bulls take longer to become pubertal, so they're older at puberty, and they had smaller testes compared to the adequate one. And if we increase, so give a better nutrition, or more nutrition, or more food available, they reach puberty at a younger age, and they have larger testes. Most of this happen if this increase in nutrition is before 7 months old. Okay. This is another study here. So now they're using Angus and Angus Charolais crosses. They had low, medium, and high nutrition, and they did that between 2 and 6 months of age. So for those of you that are interested in what I mean by low, medium, and high, I put this slide here. So basically our low nutrition here is eating just this. So it is a barley silage with 5% molasses and 5% mineral vitamin premix. And it is available at Libidon. So as much as they can eat for all the groups. The median one now, there is slightly changes on their diet as they get older, but basically it varies from 13.1 to 16.3% crude protein, with 1.58 to 1.64 megacal per kilogram of net energy maintenance, and 0.98 to 1.03 megacal per kilogram of net energy of gain. And our high one had 22% of rolled barley, 15% canola meal, and the diet was basically a 20% crude protein, 1.81 megacal for maintenance, and 1.18 megacal for gain. Okay, so they evaluated the body changes, hormonal changes, age at puberty. So for age at puberty, they had to have a scrotal circumference greater than 26 centimeters, semen collected every 2 weeks then, and they had to have greater than 50 million sperm in the ejaculate and greater than 10% of those motile. Okay, now it's a lot of figures here. Let's focus one at a time here. So if we look at body weight, as expected, when we increase, so here's the key right there on the top of the graph here. So as we increase the nutrition here, so the high, medium, and low, they actually grow differently. They're heavier. Not surprising, right? Back fat, medium, and high were pretty much similar all the way to about 50 weeks, with low being lower. And then the high just takes off and start putting a lot more fat after that 50 week. Scrotal circumference is the next one here. And we can see here there's some differences there between the median and high compared to the low. And then the high just takes off there and continue to be bigger compared to the other treatments. And PTV here is basically its per test volume. So it's the volume of both tests combined. And you can see a clear difference here between the 3 treatments, with high being bigger testes, medium excuse me, being in the middle and low being in the bottom there. When we look at the hormone profile here, if you look at leptin, insulin, and growth hormone, not big differences there, not much to talk about. But there is this other hormone here that is IGF-1, that is insulin-like growth factor. It's basically a growth factor, is responsible to growth hormone. It's produced here by the liver, but it's produced by several other cells as well. And it's interesting. It's related to growth of the animal, and we can see here clear. But there's other function, or it's associated with other functions as well. And we're going to be talking about this in a minute. So if we look here, some of the hormones. When you look at FSH, there is not much going on here until they reach that 59, where that I1 that they start separating each other there. LH, they didn't see much of a difference there. There's some peaks there that seems difference there, but not really much of a difference between treatments there when they look weekly blood samples. Testosterone was very interesting here. So if we look here, especially early on here, the rise of testosterone was anticipated on the medium and high nutrition compared to the low, which we're going to start seeing here impacts of that earlier testosterone rise on some other factors there on the physiology of those animals. So now we are looking here at LH concentration here, okay, and pulses and pulsatility. Not much, except I want to really focus on here on this number of pulses. So the clear or white bar here will be our high, the gray bar will be our median, and the black bar will be our low diet. And we can see pretty much after 14 weeks, we start increasing that pulses. And I showed you before, that is really what we want to do physiologically. That's what they're trying to do when they're injecting GnRH. So we actually can do what they're trying to do with a bunch of injections every 2 hours with GnRH by simply improving nutrition. We can increase that pulsatility of this hormone, this LH. That what is doing? It is improving testosterone production, and it is anticipating puberty. And that's what they saw. When they look at this, age of puberty here, the low energy, or the low nutrition, sorry, it's not energy, it's nutrition in general, it's the whole thing. I take longer to become pubertal compared to the median and high nutrition. Now, if we look here, we're talking about these two below 330 days reaching puberty, right? So likely most of those would have a good quality or have reached puberty to have good quality by a year, 12 to 15 months when we were doing our first BSE. But these bulls down here, they have a much greater window from when they become pubertal. So remember, 50 million at a 10% motility to improve that machinery, to start working on and getting everything fixed, to be that 12, 15-month old, to be at that 30% motile, 70% normal morphology with high enough quantities. So let's me get back to that IGF that I was talking about. So there is a strong correlation there between that IGF with the testicular size and the testosterone concentration. And I showed you a little bit on the previous graph. I didn't spend a whole lot of time there. So when change in nutrition is affecting that hormone, is also affecting testicular size and testosterone concentration. And it can, if we increase that the concentration of this IGF-1, it can change puberty. It can impact the puberty there, and can promote an increase there in testosterone concentration, which it's regulated by Leydig cell, or regulates Leydig cell multiplication, which is the cells that produce testosterone. And it can induce differentiation of the cells in the maturation. So see how all that is feeding back to each other, and testosterone actually upregulates the release of IGF-1. So all this kind of feedbacks together and we do one thing here, and that keep moving the needle to help those bulls be better as they progress towards their sexual development. So that nutrition pre-weaning, so before 7 months of age, and here's the key. So this is, if we think about our beef operation, this is the nutrition they will get while they're still nursing their cows. Has a great impact on our bull fertility. So that it can affect the gonad development, the endocrine system, and also the sperm production machinery. So the pre-puberty nutrition will impact the ovolate secretion, so the hormone secretion, age at puberty, which is where we will be seeing things, the testicular development, again, scrotal circumference will be one, mass motility and progressive motility, semen volume, and sperm concentration. So it will really, all that potentially impacting the fertility of those animals. So what about the mature bulls, right? I've been talking about those young bulls. There is not much research out there. I'll start with that. So there's a few research there, and some of them focus on high energy. So comparing maintenance to high energy, what would happen? So on this study, they make body change. So one group, so the high energy here, gained 2.2 kilograms, so about 5 pounds per day. And the other one pretty much maintained weight. So they were able to increase rump fat and rib fat. Didn't change intramuscular fat, but that's not really surprising based on that. So it's only 6 to 7 day trial there. In this study, when they did this, they didn't see much differences in the semen quality of those bulls. And I know the group, and they're like a little disappointed with the semen quality results that they're getting. But then they went ahead and did some in vitro fertilization. And surprisingly, even though there was not great differences in the semen quality, there was difference actually, but we're just not seeing, or we didn't know what to measure actually. So if we look at the high bulls here, they had decreased cleavage rate, basically the ability of that sperm to fertilize. So it is lower. Now, not only that, the ability for those embryos to develop, so to form blastocysts, which is a stage of development, was also impacted. And when we look for those that actually fertilized and then became a embryo, or so further developed, it's even greater differences. So there is a lot of things going on there when we put the extra fat on those bulls that we're still trying to understand, but it does impact that embryo. So things that if that increasing fat is actually to a certain extreme, and they actually start putting fat in the scrotum there, it is start causing scrotal insulation, which I talked a little about with you with when you induce that testicular insulation, that they basically put a bag around the testes for that study. But here is with fat, we will start seeing that abnormal sperm coming out. That wasn't the case here on this study. On the previous study that I showed you, that there wasn't a big difference there in morphology, but it could be some other things. Okay. So when you think here overall on the notes on that bull nutrition here, so when you think about the development, those bulls need to have appropriate nutrition so they can reach puberty early on, and they will be able to go out and breed cows when they're roughly 15 months of age. This is the job of our seed stock producers, or people like we have our bull tests here at UT, so to help our producers. So that is the job of the seed stock. After we buy those bulls, or the bulls that we already have, what we need to do is we need to make sure those bulls maintain a good nutritional status. We don't want them overweighted. We don't want them underweighted. Okay. Overweighted, I just showed you, I just explained to you that some of the impacts that could have in our fertility. Underfeeding or underweighted bull, I didn't really spend a whole lot of time here, but I don't think it's hard concept, right? So if the bull is starving, it doesn't have condition, that bull's reproduction is not a priority, right? So that bull's gonna, hey, I need to survive. He's gonna go look for something to eat instead of looking for cows to breed. So prior to the breeding season, what we are thinking about is we need to maintain those bulls somewhere around the 5.5 to 6.5 body condition score on a 9-point scale. If they're over conditioned, so I'll say probably if they're a 7, they're just fine. It's a little over, but I wouldn't worry as much. If they're above that 7, that's when we probably need to start working on stepping them down a little bit before they go out with the cows. If we're talking about yearling bulls, we need to remember those bulls are still growing. They still need to gain somewhere around 1.5 to 2 pounds per day, even when they go out with the cows. Okay, so they need good nutrition. If they're under condition, just give them more feed. If they're good condition, we just need to make sure we adapt them to when they go out in the forage there and be able to graze and breed those cows without losing a lot of condition. Now, during the breeding season is where we have the least amount of control. It is limited to what is available for those cows. What we can do is we can monitor the body condition score of those bulls. If they're losing too much, maybe we need to pull them out. But a bull to lose 100, 200 pounds, it's normal. That's actually expected, since if the bull is actually breeding cows, if he's doing a good job, he's not eating as much and he will be losing a lot of weight. So 100, 200 pounds, about 1 body condition score. So if he goes in at 6.5, he would be about a 5.5 when we pulling him out. If he's a 5.5, you would expect him to be a 4.5. So after that post breeding, so we need to make those bulls regain condition. As I just mentioned, they will lose some condition. If we're thinking about the young bulls, we need to make sure they still maintain that growth until they're about at least that 24-month mark. Our older bulls there is already in good condition. We can just manage them on a roughage diet, somewhere around 8 to 10% crude protein and offering about 2% of body weight. The goal is to maintain them within that 5.5 to 6.5 body condition score. Probably it is easier to maintain them or try to keep them at 5.5. And then when you get closer to that breeding season, we bump up nutrition for them a little bit to get them to around that 6.5 before they go out with the cows. Just a little bit easier to maintain. So in summary here, if low nutrition during that pre-pubertal period will cause decrease on those gonadotropin releasing hormones, delayed in an increase on circulating testosterone. We're going to decrease the size of the testes. We're going to delay puberty, and that cannot be compensated by just putting a better plane of nutrition after we wean them, basically. So after that 7 months. The high nutrition is basically all the opposite than the low. So we're going to increase the release and the pulsatility of those gonadotropin hormones. We're going to anticipate the increase in testosterone. We're going to increase testicular size. We're going to anticipate age of puberty. And the benefit that we are seeing here can be sustained if they have moderate to adequate nutrition on the puberty period on that post weaning. So, and finishing up here, those nutritional changes in the mature bulls may negatively impact semen quality. So we really want to maintain those bulls at that 5.5, 6.5. Luckily for us, usually if they're overweighted or underweighted, it's transient or transitory effects, so we can get them back on track by putting them on a good plane of nutrition. However, if we go back to the beginning of this presentation, this spermatogenic cycle there, it takes about 61 days. So we have to remember that it will take us about 60 days to get everything back to normal. With that, I think it was about an hour presentation here, and we have plenty of time here to talk. So if you guys have any questions, go ahead. I don't know if do we have questions there in the.
Awesome. Thanks, Dr. Zoca. We've got 2 questions so far in the Q&A box, and I'm sure we'll have a few more to follow as people start to type those questions or think about some different things you talked about here tonight. So I'll go ahead and start reading them off if that's okay with you.
Absolutely, go ahead.
All right. The first one out of the gate. What are the requirements for a bull to be TAEP qualified?
Okay, so the TAP qualifications is about to come out. The new ones are now in September. So that they'll have to be. Let me see if I can remember everything on top of my head. So they have to have 840s. They have to pass a BSc. They have to be purchased within the window that they have there. And they have to meet the minimum EPD qualifications that will be posted. The new set will be posted in September. So that'll be what they need to do.
Awesome. And then I'm sure your local extension agent will have some more information regarding TAEP qualifications as well. So I would be sure to reach out to them specifically or especially to make sure that we're giving you the right information as well.
Yeah, and if you have, if you're in doubt there or you want to check before you buy your bull, if you go to our UT bull test, we'll have a link there that you can type it in, the EPDs of your bull, the accuracies, and it will let you know if they qualify for one of the categories that we'll have there.
All right. Up next, what is more cost effective, nutrition versus pulse normal therapy for developing bulls?
Nutrition versus what?
Pulse normal therapy.
Not sure what post-normal therapy would be, but nutrition is much easier. I'm not really sure if it's talking about the generating injections that they're talking about. No, nutrition is much more accurate. If we're talking about the generating injections, it's every 2 hours. It is really for research and understanding how that works, but we can have the same impact with nutrition. So if we can really push nutrition early on in the life of those bulls, we can really have great impact. So I was reading today actually, milk is a huge factor there. So if we think about calf nutrition, right, before 7 months they're nursing, so those that are born from younger cows, they'll have less of that nutrient rich compared to those that are born from our mature cows, 3, 4, 5 years old plus. So I think the prime window there that they saw there was the maximum benefit was somewhere between 5 and 9 years old. Before that, it'll be growing, and of course, don't take it as ever first calf heifer will be bad and ever 5-year-old will be good, right? There is exceptions for the rule, but when you think on averages, as they mature, so that really good heifer she would likely have even better calf as she matures. Just think on that one animal. As she matures and she produces bulls, she'll get even better bulls out of their more mature, earlier maturing, all that will be associated.
I see we had a typo. It was pulse hormone therapy.
What do you say?
We had just a small typo. It was nutrition versus pulse hormone therapy instead of normal.
No.
I gotcha. All right. What is the age range for a young bull to breed 10 heifers?
Yeah. If he needs to pass a BSc. If he passes a BSc, he's good. 10 heifers is not a much to ask. So I wouldn't, probably 12-month old is the earliest I'll try to throw in a bull out. And the rule of thumb is one passing a BSc And then between 12 months to 24 months of age, one female per month of age. So 12-month-old bull should easily be able to breed 10 heifers.
Awesome. Up next, it seems that more bulls are not passing soundness exams. What do you contribute this to?
Um, not not sure. Where is? Let me find that question. Can you read it again?
Yeah, if you open your Q&A box too, they should pop up right there as well. It
Okay.
seems more bulls are not passing soundness exams. What do you contribute this to?
It depends. So that is a lot of depends in there. That's, as a good extension specialist, I'm gonna use depend a lot. But it really depends. Nutrition can be a cause, genetic can be another cause, uh, early nutrition, late nutrition, fat deposition is another one. We are doing some studies that is showing that if they are if the increase in back fat decreases the semen quality and increases the chance of them failing a BSE. So there are several pieces in there: temperature, what, not just nutrition, but what is in that feed stuff that they're eating. So all that can have an impact on passing and failing a BSE. So it is hard to be specific.
Oh, I had myself on mute. Sorry. If a bull was a twin, does this cause any issues?
So there's two ways that I'll look at it. First, if it's a male and a female, the female we know is a free martin. There is some negative impacts on the bull, but it's not infertility. So it is more complicated. It may be okay. It really depends on how much was exchanged between the two. Usually, it is more likely to be okay than not. Now, if you have two, the other issue is, and it goes with the next step, if you have two males. The biggest issue is with the twins, they're smaller. They'll be born smaller, right? So for them to take up that growth and reach their maturity, it probably will take more for them. So it may negatively impact their life on that scenario, if that makes sense.
Awesome. Okay, up next. Is there a rule of thumb for the pounds or percent body weight of additional feed to give a bull calf during development phase? I know it depends on protein/fat content.
So I would try to have something around that 14 plus percentage of crude protein. And to be very honest, up to 24 weeks, as much as they can eat. I know it's a hard concept, but up to 24 weeks, one, they're not eating that much, and two, there's usually better benefits. Now, I'll probably decrease after that 24 weeks, one, mainly because of cost. I'll still stay with hopefully the whole think about the whole diet being roughly 14% protein, not the supplement. So try to think about what are your grasses, things like that. Percent of body weight. As they start getting older, maybe half to 1% of body weight might be okay. There again, I'm not a nutritionist, but that's kind of what I would do, somewhere between half to 1% of body weight there on feed their supplement. considering they have good forage and good milking cow.
I know from the forage side of things, we recommend half to 1% of body weight just during a high production stage, like when we're breeding cattle off of, from a bull standpoint, or if we're at a gestation phase for our cows. And so if that helps from the forage side of things.
So you
uh,
mean supplement, right? The supplement a half to one,
right,
right? So
right,
yes, that's kind of what I'm thinking too, and it's a higher, probably a higher quality supplement for those bulls, right? We're talking about bulls.
right.
Not we're not talking about steers and other things. That is a different diet that I'll offer.
All right. How many days should you soundness check bulls before turning into cows?
That's a great question. So I would recommend you doing 60 days before. The reason for that is it gives you enough time if you have to retest an animal, and also give you enough time if that bull fails to go out and figure out what I'm gonna do. As you get closer to that breeding season, the harder it gets for us to find a replacement for that bull, or a good replacement, right? Not just a replacement, but find something that is good.
Okay. At what age should a bull that's still sound and breeding cows be replaced?
Not a really, really good question there. So as long as the bull is sound, technically you don't need to replace him. However, we need to take some things into consideration. Are you keeping replacement heifers? Is this bull breeding his own offsprings? Is this bull getting too big and heavy and is going to start hurting females because he's too big? Or is his weight going to start impacting his structural soundness, not just semen quality? So those are the things I would consider. So if you're keeping heifers there, you probably need to get rid of that bull earlier than if you're not keeping heifers. If I hope that answered your question.
Good deal. And then I see one more in our chat box that I'll read off, and then I'll wait a couple seconds just to make sure we didn't have any last minute thoughts or questions. So this last one, it seems I'm having a lot of males instead of female calves born. Should I change bulls?
That's a good question to that is a funny question as well. So as population wise, we should always be really close to that 50-50. Now, there is some other factors that biology is not a perfect math. So there is evidence that some bulls will turn out more males than females, and vice versa. But there's also females that will always turn out and put female calves or bull calves on the ground. And there's some relationship there or at the uterine environment and things like that. So if you should change bulls, I don't know. That's a good question. You could, but one thing is you don't have issues with that bull being covering his own offsprings. And you can always go out and buy some replacements if that's the case. I don't think changing bulls would completely solve the problem. And I I would like to have more bulls than more steers than heifers if I could. So that's usually what we try to do with, excuse me, with sex semen. So for me, it would be a good thing. But if you're not getting any, that's a different scenario. But you could go out and find some good replacement heifers and buy them pregnant and take advantage of the current market, high prices of steers and everything.
Right, and then we had one more pop up in our Q&A box. What would you recommend if you have accidental inbreeding?
accidental inbreeding. It really depends. So if we're talking about one generation, I think that is less of an issue. Now, if it's multiple generations, that's when you probably should be worrying about some of that. Um, Cattle can tolerate a good amount, but we start seeing some issues. But the good thing is you can outcross, and in one generation, you pretty much get rid of it. So I wouldn't be, if it's it's an accidental and it's a few animals, I wouldn't be super concerned. And as soon as you change bulls, making sure that you're in a different genetic and try to go to a farther genetic that you can, you should be good.
All right. That was our last question that I have a hold of right now. If anyone has any last minute questions or thoughts, please be sure to share those in the chat box or the Q&A box.
Have Troy called, Mallory?
I'm sorry.
Have you do you have Troy coming doing a talk or
Oh, I gotcha. Dr. David Lawman will actually join us at the end of the series. He's our last speaker of the series, and he'll talk more about kind of genetics from a nutrition standpoint. So he may cover some different things that you've talked about tonight as well, and kind of incorporate those into his presentation. So that'll be good too.
Sure, absolutely.
All
Yeah, because
right.
so the inbreeding question, if it's not clear, I encourage you to go to Dr. Rowan. I'm gonna type in his email in the chat box here.
Perfect.
So feel free to send him an email and he would help you. If it's again, if it's 1 year and it's few animals, it shouldn't be a big issue.
All right, I shared it in the Q&A or in the chat box as well, just so everyone had a hold of his email if we had any questions regarding, inbreeding or genetics. So he can answer those. That's definitely out of my depth.
Oh, I guess it's in just you.
No, don't send them to me. I would be a dangerous bet there. Again, thank you, Dr. Zoca, for joining us tonight. I don't see any more questions in our Q&A box or chat box, but his email is listed on this last slide here. So if you have any questions that you think of after tonight's webinar ends, please be sure to give him a shout out, and we'll get those questions answered straight away.
Okay.
Again,
Hey, I'm just gonna let's see if I did it right this time.
oh, you're
Can
good.
did I send to everyone?
I think so. You're good.
Okay. This is my cell phone. So if any of you wanted to contact me, call or text me, feel free to. That's my work private, all the above phone. So
Awesome. Okay, good deal. Again, if anyone has any questions regarding certifications or attendance, I just handle Master Beef webinar series attendance questions like that. So if it's anything besides that, we'll be sure to contact your local extension agent just so we make sure we get you the right answer. But if it's anything regarding attendance or recordings, I'm your gal. So my email should be listed in the chat box somewhere, and I'll type it out again right currently. So just check it's the most.
today, since you're just wrapping up here, just want to make a few more. So next week, September 24th, so next Tuesday, we have our field day here at the Middle Tennessee Research Education Center, the Beef and Forage field day. Everybody's welcome to come. I believe it's a $10 fee. That's basically to help us cover lunch. And on October 18, we have our heifer development program field day in Lewisburg, our Middle Tennessee Research Education Center in Lewisburg. Just go to our website and you're going to be our Facebook. We're going to be able to find those links. Please come. We'll welcome everybody. And one more announcement. So I am the director of our bull test. And if anybody is interested in putting bulls on the bull test for next year, so this year's we already have the test going on, so no more intakes. But for next year, just contact me. And our bull sale this year has changed, and it's gonna be December 12th. Okay, at same place in Spring Hill. You're gonna be able to go look at the bulls, and then we are back in the conference room for a live slash virtual sale. So we have videos there. We're not bringing bulls to the sale, but and we also have an online.
Good deal. I'm glad you mentioned those field days. If anyone attends, be sure to stop by the Beef and Forage Center table and say hello. I'll be there as well. So we'll have a good time down in Spring Hill. But all right, I think that wraps us up. Again, if anyone has any questions, please be sure to email me or Dr. Zoca and we'll get those taken care of. But with all that being said, we're done for tonight. We'll see everyone again next week. Thank you so much.
Bye.
Thank you, Dr. Zoca.